I'm the co-director of an atrial fibrillation comprehensive program at Yale. Atrial fibrillation is the most common cardiac arrhythmia. It affects 15% of people over the course of their lifetime in the United States. And so I see just a tremendous number of patients with atrial fibrillation in my clinic. I really love the interventional side of things, working with my hands and doing some of the procedural work, but then the intellectual side is really spectacular in EP. It's really the most interesting and dynamic field in medicine. I think one of the things that's interesting about atrial fibrillation is just how variable the symptomatology is, and there are some patients for whom the symptomatology associated with their AFib is really disabling. And but many of them have been in it for weeks to months to years in some cases. And so trying to get that rhythm under control, even if it's causing just great symptomatology in that patient, can be very, very challenging. And so having options like this that are more complex procedures but may allow us to really help someone who is fairly far along with their atrial fibrillation and who's highly symptomatic is really very exciting. The persistent atrial fibrillation has really been, to some extent, the Achilles heel of AFib ablation. It's just a difficult area, and there's been a lot of challenges trying to move the needle in terms of trying to improve the effectiveness of our efforts for controlling the rhythm in that context. So when patients come in with persistent atrial fibrillation, I think of this study. And so the idea is to electrically isolate the left atrial appendage using the lariat procedure, and then do a pulmonary vein isolation or standard catheter ablation for atrial fibrillation. So the trial was very well designed. It's a superiority trial that's designed to look at catheter ablation with pulmonary vein isolation, which is kind of the standard of care on one arm, and then the other arm to add as an adjunct to that the lariat procedure. And we'll see what the trial shows, but certainly if it were to show superiority with left atrial appendage closure and electrical isolation of the left atrial appendage, that would be a paradigm shift in the field. In the care of, it would be certainly a paradigm shift in the care of patients with persistent atrial fibrillation.